I am so happy that someone sent this question in because it's not discussed enough in regards to breast reconstruction. And that's, do you need blood thinners after a flap surgery? I will tell you that there are so many studies looking at whether or not people need blood thinners after surgery, and pretty much the evidence is inconclusive. So most of what we do for blood thinners is based on anecdotal evidence or institutional protocols. What we do at my institution is we keep patients on Lovenox while they're in the hospital. Why? You just had a big surgery. You just had potentially plication or tightening of your abdominal muscles, and you're just not moving around as much. So all things that could increase your risk of having a blood clot. So while you're in the hospital not moving around, we do keep you on blood thinners. I don't send patients home on blood thinners after that, and most of my partners don't. Some institutions do. I will tell you though, I have two different instances in which I would send someone home on blood thinners. The first is if they're at any increased risk of blood clots. Even if it was like a provoked clot in the past, I'm probably going to send you home on blood thinners just to be safe. The second is if you do have a known bleeding, clotting disorder, I am going to send you home on blood thinners to make sure that you don't get clots while you're at home, even if you're moving around. Now, blood thinners aren't benign. You might just say, well, just put everyone on blood thinners, right? Yeah, but they thin your blood. So if you're recovering from your flap and you fall on a blood thinner, that can be a really substantial injury. Like so many things in medicine, it's a balance of risks and benefits. And if we don't have high quality data to help guide our decisions, which we don't in the case of blood thinners, then a lot of it is just individual preference when it comes to the surgeon.